Welcome everyone to California WIC Association's WIC Works webinar. We're glad to have you with us this morning. We have some great things going on about breastfeeding support in medical offices after the hospital. So this is Margaret Allman, Communications Coordinator with California WIC Association, and we'll be hearing from Karen Farley, our program manager. She'll be your host and introducing our speakers, Jennifer Stewart and Susanna Sibilski, and then we'll have time for questions and answers. I'll be going through some introductory slides. But overall, our objectives for this short webinar today are to look at the steps to a baby-friendly medical office and find out some strategies for partnering with healthcare providers in your area. Just a few words about using GoToWebinar. You may or may not be familiar with this particular program, but you can listen if you have a computer with speakers and microphone, or you can dial in by phone. There are some phone numbers here on this slide, but at the bottom of each of these introductory slides if you have any internet audio problems. And if you are connected by phone, just to remind you not to put a line on hold. It can disrupt the entire webinar. And if you can't see the slides, try exiting the program and then re-entering. We've had that problem on past webinars. And there's a help line there. I'm just going to do a quick audio check right now and ask our speakers to say hello. I'm sorry I didn't do that earlier. Jennifer, good morning.
Hello. Good morning.
Great. And Susanna?
Good morning.
Okay, so hopefully you'll be able to hear everybody. And Karen and some other staff are with me here at CWA. Just to review your control panel, you have a way to hide a screen and make it come back. You can, if you're going to use your telephone, click here in audio mode, and it'll give you the information you need, including a PIN number. We won't use the chat box, but if you have questions, please type them into the question box. And be sure to press send so that we get to see your question, and we'll look at those and address the panelists, and you'll get some answers for what we have time for. And you can also contact the speakers after the webinar if you have additional questions. We are recording this webinar, and it will be put on our website afterwards. We're not offering continuing education units, however, because it's so short, but we hope that you will get some information to get you started and interested. Just a quick word about who we are at California WIC Association. We're a nonprofit organization serving all the local agencies in California, but we do represent parties nationally and statewide who are interested in the WIC, or Women, Infants, and Children Supplemental Nutrition Program. We provide training, staff development, education and advocacy, and some research and policy analysis. So we hope you'll check us out on our website, calwic.org. I'm going to turn it over to Karen Farley, our program manager now, and she's going to introduce our speakers. Karen?
Good morning, everyone. Thank you for attending this webinar, and thank you, Susanna and Jennifer, for sharing your expertise with everybody this morning. I'd just like to briefly introduce Susanna and Jennifer, and then they can take it away. Susanna, after finishing a degree in nutrition at UC Davis, emphasizing maternal and child nutrition, jumped right in with an Peace Corps volunteer experience in Haiti. Upon her return to the U.S., she worked for over a decade in Southern California on healthcare access for low-income moms, working with hospitals and healthcare providers to establish one-stop hospital-based prenatal clinics for Medicaid and Medicaid-eligible women. And currently, she's a regional breastfeeding liaison for Shasta County WIC, focusing on providing training and additional resources to physician offices for improving breastfeeding duration. Jennifer's been working in public health for 23 years, serving in a variety of capacities, not only in WIC, but in HIV, CHDP, and clinical services. The last 12 have been with lactation. Currently, she's serving in the Riverside County Public Health Loving Support Breastfeeding Program, which has a lot of really creative things going on. It's particularly funded by First 5 Riverside for the past 12 years with continued funding for the next 4. And they've been very successful with a 24-hour breastfeeding helpline and breastfeeding-friendly physician program. I just wanted to add that the material they're going to share today is very tried and tested. So they have a lot of good evidence to go on that physicians are really happy with this material and it can be really effective. So with no further ado, I'll turn it over to Susanna and Jennifer.
Well, good morning again, everyone, and it is our pleasure to be able to present the work that we're doing and hope that we have some ideas that you can pick up. Next slide, please. We think it's really important to get to know what the major health organizations, what their policies about breastfeeding are. You guys probably know that the AAP came out with their 2012 policy statement, breastfeeding and the use of human milk. And if you were familiar with the 2005 one, you know that they made some significant improvements in how important it is to breastfeed exclusively for the first 6 months and then continuing on to a year. Even so, this time recommending the 10 steps to successful breastfeeding, which was a new addition to this policy statement. And many of the health organizations are very, very supportive of breastfeeding and breastfeeding exclusively for the first 6 months. So get to know those sorts of references because it's important that we show the physician community that we know a little bit about the organizations that support them. Next slide, please. There's an interesting piece of research that actually shows the impact of physician encouragement on breastfeeding initiation. And, you know, I think you can see from the 3 bullets how important that physician encouragement is to women who are likely to be on the WIC program. And not only was it spoken physician encouragement that increased breastfeeding initiation, but just the perception. So if you can get an office just to post posters and have flyers showing breastfeeding women, even that is helpful to getting women to say, oh, my physician thinks this is important. Next slide, please. And I think the Affordable Care Act has done a wonderful thing for us in terms of being able to get into the physician offices with breastfeeding resources and trainings and partnering with them because, as you probably are aware of, one of the no-cost preventive services under Affordable Care Act is the breastfeeding support supplies and counseling. So I have to tell you, this is just like my delight that, you know, we can take this in there and really help create that partnership because this is something that's going to be really expected of our healthcare providers come January 2014. Next slide, please. So how can WIC help with creating breastfeeding-friendly physician medical offices? Really, the sky is the limit when we develop those relationships. So right now I'm going to turn this over to Jennifer, and she's going to talk about what's been going on in Riverside County. Next slide.
This is Jennifer. Thank you also very much for listening in, and definitely please email with any questions you might have if they're not answered during the webinar. Next slide, please. So in our department, we were lucky enough to receive funding from First 5 Riverside, the Children and Families Commission, the Prop 10 tobacco tax beginning in 2001. And our original funding was for a 24-hour breastfeeding helpline and a physician outreach program. And then we've also received a one-time WIC grant to provide education to physicians. And that was the beginning of our breastfeeding-friendly program. And so beginning in 2005, physicians could obtain this designation by achieving the 7 steps. And we did it through Riverside County Health Department and Loving Support. Those were the 2 entities that designated them as breastfeeding friendly. Next slide, please. And the goal of our grant was to provide seamless services for the women of Riverside County. We really wanted to make sure that the same breastfeeding message would come from their OB provider, the WIC office, the hospital, and their pediatric provider. And also, of course, to support the AAP recommendation, infants are exclusively breastfeed throughout the first year of life. Next, please. So what our vision is we wanted to be like the pharmaceutical reps, but our goal was to sell the idea of breastfeeding. So if we marketed it to physicians and nurses and other professionals, that they would market breastfeeding as the expectation of how they fed their babies. Next, please. So in the beginning, we contracted with educational message services because they've been successful up in Santa Barbara. And so we contracted with them, and they came and they trained our staff on how to approach the physician office, the initial contact, getting the agreement signed that we could go into their office, setting up the exam room because we had our displays in the exam room, and then also the follow-up contact. And in the beginning of our grant, we went and restocked the displays every 2 weeks. Because it was very important to start a relationship with the office so they could see us coming in, get to know us, we're friendly, we're nice. Next slide. So our first one is the one on the left, breastfeeding. It's too important not to. Ask why your doctor recommends breastfeeding. And then on the next slide, you'll see what the takeaway card was. And then call now to join the Loving Support Club, because we figured all the formula companies have those clubs that you can join. And then our more recent display, having a baby know the facts, feeding your baby shouldn't be a business. And then they all have our 888 number of our 24-hour helpline. Next slide, please. And this is just a little sample of our takeaway card. It was an accordion-fold takeaway card that we put in the displays, and the moms could pull it out. We had information about going into the hospital and when you get home. And then actually the Lego stack that you see on all the WIC flyers and everything was created during the special WIC grant down in Riverside County. Next, please. And then for the office visits, our breastfeeding reps visit over 250 offices quarterly. And depending on funding, when we had more funding in the beginning, we visited monthly or every 6 weeks. So it's kind of changed as our funding increases, decreases over the past 12 years. So we would restock the wall displays. We'd bring WIC information, updated breastfeeding research, local resource lists. And I have to say that probably for us, the best thing is we had our 24-hour helpline. So when we went to the doctor's offices, you know, we told them about breastfeeding, how they could support, and we said, you know, you don't have to be the expert. You can refer moms to call our helpline. So that was actually the best bonus to our program. And then we entered information into our database. So if a mom called for the infant feeding package, which was breastfeeding information, we got them into our database, and part of our grant was calling all the newborn moms in Riverside County. Next, please. So just as pharmaceutical reps have done in the past, we've given the following outreach materials to the offices. So we gave lunch boxes, coffee mugs, lanyards, badge holders, pens, notepads, wall clocks that say time to breastfeed, clipboards and wall calendars, and then all have our breastfeeding message and loving support information. And currently, because we have less funding, we have really nice pens that we take out to the offices. They love the pens. If we show up to do something, they'll say, did you bring us pens? So actually now that's been a really good entree into the offices since we don't have all the other things currently. Next, please. So in 2005, we did have the one-time WIC grant to provide the education to the physicians, and that's when we started the breastfeeding-friendly physician program. So they could obtain it by achieving the 7 steps. Next, please. So basically, the physician had to commit that he would support the 2 recommendations from ACOG and AAP, that they would explain to breastfeeding that each patient that breastfeeding formula are not equal, remove items displaying the formula company's logo, and we would go through the offices and double check for them, have pictures, posters, brochures, and other displays that promote breastfeeding, increase breastfeeding knowledge of their employees on an ongoing basis, have current breastfeeding reference books, and those several years we had enough money that we would supply those. And they need to know the breastfeeding referral sources in Riverside County, and we keep them updated on those. Next, please. So the lunch and learn topics, and when we have the first 5 money, we were able to provide lunch, which is also a great entree into the offices. So we've done breastfeeding facts revealed, formula does not stack up to breast milk, and that one is probably the best one that we did because they don't know. Staying on track, do you know the stations for help, 3-step counseling, are you making the grade, achieving breastfeeding friendly in just 1 bottle. Okay. So then in 2010, our first 5 fundings for the breastfeeding friendly physician ended, and that's when we got the WIC Regional Breastfeeding Liaison grant to continue with our breastfeeding friendly physician program. Okay. So this was really good because with the new food package and everything that's going on WIC, so we had regional WIC nutritionists who were making quarterly visits to the physician's office to promote the new WIC breastfeeding program, the WIC outreach materials, share our loving support information, same with the breastfeeding education and updates, and assess for breastfeeding friendly status. Next. So just the important parts about our program, points about our programs. We've been around for so many years that offices trust we won't disappear. If they move, they call us to bring new displays and more materials. They've had good feedback about our services. Our staff remain constant. Staff will give their business cards so an office can contact them directly if they have questions. In the past, we brought food. And then several of the years, we offered a CME for attending the Lunch and Learn, and then our 24-hour breastfeeding helpline. Thank you. That's our program in a nutshell, and I'll pass it back to Susanna.
Okay, so what's going on in Shasta County is not quite at the level of Riverside County yet, but it's great to have Jennifer to pick her brain on where we can go to next. In 2004, we also got a grant from our first 5 to start a breastfeeding support center, and it was staffed by IBCLCs and some volunteer peer counseling. In 2007, the first 5 funding went away, and the breastfeeding support center came under the auspices of our WIC program. But the nice thing was we were able to continue supporting all women in Shasta County, whether or not they were on the WIC program. In 2009, some more first 5 funding came through for a small peer counseling program where the peer counselors actually did get paid. And then in 2010, that set us up nicely for the WIC grant to expand that peer counseling program. And then also that same fall, we were funded for the Regional Breastfeeding Liaison project as well. Our 2 initial goals were to reform a regional coalition and to connect with our healthcare provider community. Next slide, please. So one of the things that we thought would be important for connecting with the healthcare providers was to create a toolkit that could somewhat get us in the door, because we didn't have quite the funding to take the nice doodads and things that often get the other types of reps into the doors. And one of the things we did was put together kind of a sample toolkit, and we had a small focus group with some physicians, and they included OBGYNs, pediatricians, family practice, and we also had a resident as well for the toolkit. we wanted to then introduce trainings that we could do for the office staff once we had kind of introduced the toolkit. And one of those trainings would be on how to use that toolkit. Also the changes to WIC, because we're still looking at a population here who thinks that the WIC program is the formula program. So we realized that we needed to do a lot of education about some of the really wonderful changes, not only to the food package in WIC, but also in the types of breastfeeding services and support that WIC offers. And you can see the other kinds of trainings we're thinking about. We're looking at providing some continuing education, but the process is a little bit cumbersome at this point, but we're still working through that. Next slide, please. So it was interesting what we learned from our focus group. Our physicians actually like to be called clinicians. So our toolkit is called In Support of Breastfeeding Clinician Toolkit. They also wanted things put very simply for them. They wanted the facts. They wanted information bulleted. They really wanted to know how to refer for breastfeeding support, because they didn't want to be kind of left on the hook doing it all by themselves. And the resident, he was wonderful. He actually said that they got no breastfeeding education during medical school, and he would like a training that actually had a mom who was breastfeeding present at the training, kind of like a show and tell. Next slide, please. So here are some of our facts, and this kind of made a big point with us too, because we could see from this graph, even though intention to breastfeed along with initiation in the hospital, we had serious drop-off in duration beginning just with the first month of breastfeeding. So this is actually the opening page to the clinician toolkit, so that we can really get that point across that there's a lot of work that we are probably missing in that first month, and working together, hopefully we can really have an impact on that slide. Next slide, please. So the toolkit also highlights our peer counseling program. The grant increased the number of peer counselors that we had, and we're actually able to have them placed in all of our WIC clinics around the county. We wanted to let them know the level of training that they received before becoming peer counselors, as well as some of the quality assurance that they're held to. We thought it was really important to highlight those peer counselors. Some of the sections in the toolkit are maximizing revenues. And we wanted to make that point so that physicians could see that they actually could use breastfeeding as a billing point. If they were either helping with the mom or the baby, there was a way for them to bill for that assistance that they were doing. We have a clinician education and resources section, and the nice thing with the new update to the AAP policy is we can go back to some of those physician offices that we've already been to and update their toolkits. And in our focus group, we included the WHO growth charts, and those physicians, they nixed them. But now that the AAP update is recommending the use of the WHO growth charts. So we can also take those growth charts back in and get those put in their toolkits. WIC services is a major part of the toolkit, because we really want to change that perception that people have of the WIC program. And then we have a really nice section of different types of patient education and resources. Next slide. And we always want to ask the physician when we're there what steps they think that they can take to make their office more breastfeeding friendly, and also to let them know how we can continue to help them. Next slide. And these are just some of the comments that we've had on our Toolkit training, and I'm not going to, you can kind of glance through them, but people have been very impressed with both the physician education section as well as the patient education section. We have some of the handouts that we use at WIC and also some other handouts that we've borrowed from the Massachusetts Breastfeeding Coalition, and they've enjoyed those. Next slide. And these are some of the additional trainings that we've had at some of our physician offices as well. We do have one office. I think we've already done training number 4 for them, so it's really kind of exciting to be able to be asked back again to provide more trainings. And I think that brings us to the end of our slides. So we have a few minutes for questions, and I hope we can get to some. But here are our email addresses. So if we can't get to your questions, please email us.
Go ahead. Thank you, Susanna and Jennifer. That was really helpful. We do have a few questions. One is, one of the questions was, what topics do the physicians train on? And I think that was just in the second to the last slide. You listed some topics: breastfeeding 101, common problems, baby-led latch. I do have a question, though. When you go in to train, how are you convincing them to give you some time to train?
We usually do it at a lunch time or when they're having scheduled staff meetings.
How much time do you ask for?
We've done 45 minutes, but we've also done some smaller trainings in 15-minute segments.
Okay, great.
But it really kind of depends on what they can give us, and we'll try to work with that. And I think it's really important to show them that we can work with them. We can come back as many times for them. But I don't know, Jennifer, if you're getting more time, how you're able to do that?
No, we did the same. We go in during lunchtime, and typically we would end up about half an hour. And then there'd be people that would linger with questions, but the majority of people staying, we try to aim for half an hour. And then staff meetings work out really well, but it's been easier for us to get in during lunchtime.
Okay. Great, thanks. We have a few more questions. I think this might be for you, Jennifer. On your certification, who's actually the certifying organization?
We do the Riverside County Department of Public Health and Loving Support.
Okay. And can you review for them the 7 steps that the office went through?
Yes. So the first one is that and it'll be in the PowerPoint that's on the website. So they have to agree to work with the Loving Support Program. They have to, let me flip to the page, explain to patients that breastfeeding and formula are not the same thing. They have to remove from the office, all the formula stuff with the logo and everything. They don't have to remove formula completely from the office in case, like, for some reason a pediatrician needs them. It cannot be in view. They can't be handing it out, and it can't be in view. They need to have pictures and posters and brochures that promote breastfeeding. Their employees need to be trained on breastfeeding. We don't have a finite number. We're just starting with they need, some breastfeeding training. They have to have current reference books, and they have to know the referral sources.
Great, thank you. We've had a few questions about where these resources are. We will post these on the California WIC Association WIC Works webpage. This webinar is a series of webinars showing how WIC works. And this is an example of WIC agencies out there really making a difference. And if you get in touch with Jennifer or Susanna, they can directly send you materials or answer more questions. There was a question about whether you've been able to show any data that this improves breastfeeding rates. Have the offices been able to collect any of that data?
Actually, we just got refunded with our first 5 money starting July 1, and that's actually one of our goals. You know, we've been tracking our breastfeeding rates in WIC because in Riverside County we have a huge WIC population, so it does, in some respects, reflect what's going on in the county, but not specifically, no.
Okay, well maybe with EMRs, electronic medical records, we might have more ability to do that.
And we're also looking at our WIC breastfeeding rates because about 60 to 65% of the births in the county are to moms on WIC. So it's a pretty high percentage of WIC moms. And just in the past 6 months, we've seen a steady increase in our breastfeeding duration. So I don't know if we can say that's because of the provider offices or things that we're doing at WIC or a combination of all of those things, but we're really excited to see if we're going to get, a sustained period of months where we're seeing the increases. So we can let you know about that.
Okay. We just have time for about 1, maybe 2 more questions. One of the questions is, when you go in, are you training all the staff possible that are in the office or just the physicians and licensed personnel?
We're training all the, sorry?
No, you go ahead.
We're training all the staff possible, and for our breastfeeding designation, after the first year, we were doing the second year, the physician had to be there at the training or they could not obviously get breastfeeding friendly, and we would cancel our lunch and learn if the physician wasn't going to be there. But we want all the office staff because they all come in contact with the mom also. Great.
And as far as your staff who are going in to train, what are their qualifications?
Right now we have a lot of IBCLCs on our staff, but they've also all been trained in breastfeeding and extensive amount of training.
And our staff that's doing the trainings are also the IBCLCs.
Okay. And then we have one more question from a couple of people. Have you seen any evidence or discussion that they're starting to bill for lactation services?
Not that I've seen in Riverside yet.
And
definitely
not
in Lowell, though.
Yeah, not that I've seen here either, but yeah, we hope that that will happen.
Yeah, I know you started this before the healthcare reform came out, and that will certainly be in your favor now. There is information on CWA's website about billing through Medi-Cal and tapping into those possibilities. Just FYI for people.
That's actually a piece in the toolkit as well. So I want to thank CWA for having that resource available.
I think we're going to wrap up. There's one thing I did want to clarify and give a shout out to the state WIC program. Both Susanna and Jennifer are regional breastfeeding liaisons, and I don't think we really explained that. That's something that California WIC has been piloting, and in their position, they are charged with going out and developing relationships in the community at all levels to enhance breastfeeding outcomes. And it's been very effective. We have 9, I think it is, around the state in select areas. And so they're not charged to be clinicians. They have that expertise, but they're really charged with fostering collaborations and networks. And if you're familiar with the spectrum of prevention and all the levels at which we can make community change, that's where they function. And so that's where this type of work is coming from. And California WIC state program is pioneering that here in California. So this is a perfect example of that type of work and effort to improve breastfeeding outcomes and ultimately health outcomes.
Yes.
So there were a few more questions. I think we covered most of them. If you want to contact Jennifer or Susanna, you have their email address. This PowerPoint will be on the California WIC Association website with the other WIC Works PowerPoints. And if you have any questions, you can always contact CWA. Thank you for joining us today, and next week we'll have another WIC Works webinar addressing eWIC and WIC transitioning across the nation to EBT, Electronic Benefits Transfer. Thank you for joining us.
Thanks so much, Jennifer and Susanna. We'll hope to see many of you on a future webinar. Bye-bye.
Bye. Thanks for having us.